Instead of doing a well plate, bunch of wells, bunch of serums, takes time, and you got to set everything up. And what if you want to do something that's quicker? Well, as you can see here, there are little quick tests that should take just a few minutes. Everything is self-contained. There's no adding in serums. Oh, did I add the right one to the right well? Well, I got this big plate. It's got blood in it. Now what do I do? Blah, blah, blah. If you go to a clinic, they're going to have these little quick tests. Your textbook uses the example of the gonorrhea test. Going to test to see if either gonorrhea is present, or if you have different tests, we'll test for serology. Does your immune system recognize the presence of gonorrhea, or has you ever been exposed to gonorrhea? The one they're showing here, the clinician, the doctor, the PA, the nurse practitioner, or a nurse, depending upon where the clinic is, will take a swab and will swab the genital region, either the urethra of the male or the vagina of the female patient, and then they will take that swab and they will rub it in the sample well. Sample well has fluid in it. It will pull the gonorrhea bacteria off of the swab, and then diffusion will occur. Remember, diffusion is the natural state of all matter in this universe to go from high to low. So as it spreads out, going from high to low, it's just a natural state. There's no work being done here. So what we see happens here is that diffusion takes the gonorrhea, if it's present, or any other bacteria that's present on the swab, at the sample well, and then it will diffuse up the stick. As it diffuses up the stick, there are antigens that will be bound, or there will be antibodies, depending upon the test, that are bound to the substrate. As whatever was on the swab flows by, diffuses by, it'll get bound too. Different reactions will start to occur, and one line, two lines. The first line, test line, anything present on the swab that diffused up will trigger this to react. Or the test, the control one. The test, well, this is highly specific. Are antibodies present if this is a serum test? Are antibodies present, able to bind to the specific proteins that's been embedded in the test? If you're testing for the presence of, say, gonorrhea, there will be antibodies that are now embedded on the plastic of the test. As the gonorrhea bacteria flows by, the gonorrhea will get stuck there, and the test will react to the presence of the bacteria bound to the antibodies, and blah, blah, blah. You'll get a second line. Versions of this are what the p-tests are for pregnancy. It's not testing for the presence of a baby. No, it's testing for the presence of certain protein markers that are going to be present in a pregnant woman's urine that are not going to be present in a non-pregnant woman or in a man's urine.